In this episode of the Changing Lives podcast, we talk to Ian Peacock. In our discussion, Ian shares how he recently maximised his opportunity to head out to the mines for his clinical placement and learn in real life situations with an experienced mentor on hand who could always step in and take over if necessary.
Always work within your scope of practice, but don't be afraid to get in and take control, because you've always got somebody there that's more qualified than you while you're doing your placement.
Ian's story involves one critical patient, and we follow the steps that he took during the call out.
So we did the 2 ECGs, sent them off to Perth, and he said, this is not good. This guy could be on the verge of a heart attack. I want you to get in touch with glorifying doctors and get them to evacuate him out to Perth.
We hope you enjoy this insightful episode of the Changing Lives podcast, brought to you by the Australian Paramedical College. Hi Ian, thanks for joining us today. You're currently studying with APC. Can you tell us a bit about where you're at on your journey?
I'm doing the combo, which is the Diploma and the Cert 4. I started studying June last year, and I'm about 2/3 of the way through. I've got 5 more modules to go and 1 more workshop.
So, as you know, a large part of the practical skills element of the training is on clinical placement, which you've recently completed with the assistance of an APC graduate, Nathan Seidel. I understand your experience was quite positive and impactful. Can you tell us a bit about that?
Yeah, sure. I saw an ad on the Paramedic forum probably about 6 weeks ago. And an ex-student from Perth had organised for some students to go to Plutonic gold mine in Western Australia to do a week of placement. So I put my name up for it, and it cost me a little bit of money to get over there, but the experience was well worth it. I flew to Perth on the Sunday, and we flew out of Cobham Air Base, which is near the Perth airport. It was about an hour, 40-minute flight northeast to Billabong Gold. So that's the nearest town to Billabong Gold is Meekatharra, which is about 180 kilometres south. So that's the nearest town. Very remote, but as soon as we arrived there, we were straight into it, and the 8 days kind of flew by, which was fantastic. I got involved in a lot of incidents. Nathan, who was running the clinic, Nathan's now an emergency services officer in the mines, which is what I'm aiming to do. He was running the whole show because there's only one medic on site at any one time. But he just stood back and let me run most of the incidents that came along, which was good for me. And it also gave me a good insight into workshop 2 that's coming up probably early next year.
Was there a particular moment on placement that really stood out to you?
Yeah, there was. We arrived on the Monday, we did a handover, which takes quite a few hours because you've got to go through all the drugs cabinets, you've got to check everything off and sign everything off. But on the Tuesday, there's certain contractors working within the mine. On the Tuesday, we were called to a gentleman's room. His supervisor had said that he had the flu. So when we arrived there, Nathan said, look Ian, he said, I want you to run this. So you do what you think you should be doing, and I'll just stand back and watch. So I said, yeah, no problem at all. So we went in, we introduced ourselves, and we started going through our vital signs, asking questions. So we went through the sample, SAMPLE, which was fine. And when we got onto OPQRST, I asked the gentleman, do you have any pain? And he said, no, I don't have any pain now, but I did last night. I had a really crushing chest pain. So I looked at Nathan, Nathan looked at me, and we both thought the same thing. So I said, well, what did you do with your chest pain? He said, I just took a cup of Panadol and went to sleep. So Nathan said, what do you want to do? I said, I'd like to take him to the medical centre and put him on 12-lead ECG. He said, yeah, good. So we popped him into the ambulance, took him down to the med centre, put him on a 12-lead ECG, came back that he had a T-wave depression. So what happens is, once we had the ECG results, we take a photograph of it and send it to a company in Perth, where a doctor can look at it. And the doctor said, look, I want you to, something's not right, I want you to give him aspirin, and I want you to give him clopidogrel. So we did that, and he said, now what I want you to do, he said, I want you to do a troponin test. And apparently, when the heart's, when you've got heart disease, some of the heart muscle starts to die and it gives off a protein. This troponin test picks up on that. So it's very similar to a pregnancy test. Came back positive. So he said, look, the doctor said, I want you to do 2 ECGs 10 minutes apart because I don't like what I'm seeing. So we did the 2 ECGs, sent them off to Perth, and he said, this is not good. This guy could be on the verge of a heart attack. I want you to get in touch with Royal Flying Doctors and get them to evacuate him out to Perth. So we monitored him for about 2 hours because Royal Flying Doctors were quite busy. So when they flew in, they had a critical care nurse and a doctor on board. We did a handover, patient handover report, and they took him off to Perth. We followed up the following day and he'd been kept in overnight for observation, but they said that he was okay to leave, but he was going to be having further tests because there was something not right with his ventricles apparently. All in all, we were called at 11:15 and we did a handover at 4 o'clock, so it was nearly a 5-hour treatment plan with him, which was good because you know, you were constantly doing vital signs, etc. But that was the most memorable. But there was others. There was trauma patients coming in with shrapnel in their elbows from blasts. There was retreats where people were coming in with old injuries, and we were doing hydration tests. We were doing drug tests. We had 2 failed drug tests within the 7 days that I was there. And we also got involved in some blood tests. At the gold mine, they're using cyanide, mercury, and lead to extract gold from the rock. So that all the miners that are involved in the processing plant are tested every 6 months. So we got involved in the blood testing as well, which was quite good. Some guy flies up from Perth every 6 months, and you've just got to assist them. So it was 8 days, but it went in a blur. It really did. So it was good. Nathan couldn't do more for you. He was very accommodating prior to going because I had lots of questions to ask. And while we were there was lots of questions that I liked answering. We did an emergency response training day on a Saturday, which is part of their weekly plan. The emergency response team come together and we were doing vehicle extractions, which I've done before in the fire brigade. So it was a really, really good time. So that's just given me an insight into what happens as an ESO, and that's why I'm heading once I'm qualified.
Wow, that's a pretty involved and hands-on training experience. Can you tell me, did you feel prepared for that? And if so, what were the skills that you found yourself falling back on?
I think the skills learned at Workshop 1 helped me deal with it. That is the main thing. But also some of the theory that you think, oh, I've forgotten a lot of things, but when you're put in a situation, it all comes back to you. And as Christy and Jens have always said, if you remember your ABCs, everything else falls into place. And because of the questioning that you do with your sample and your OPQ RST, everything falls into place and you can treat it from there. So yeah, Workshop 1 was just gave you that knowledge to, and the confidence to go forward and do most of the things that we did.
So what impact do you feel your whole placement experience had on you personally?
It gave me an insight into what I can expect once I'm qualified and I'm out in the field. And I just wanted, while I was there, I just wanted more of it. And I know it sounds, because, you know, when you get called to an incident, it's somebody's misfortune that something's happened to them. But on the other hand, it's giving us the experience to go forward and work on bigger and not so much better things, but bigger things.
Okay, and specifically your development as a student in the context of the qualification that you're doing, what significance and role do you think placement has?
Oh, it's played a big role, but the instructors have been good right through, and right from the get-go at workshop, it was drummed into you, you know, about your ABCs. But it was a great learning curve, because I did 10 years fire rescue, but the things I've been exposed to, not so much in workshop, but on placement, you're just looking at an emergency situation from a completely different angle. And I thought I was very experienced, which I am. I've been to a lot of car crashes, I've been to some airplane crashes before, but working on the medical side of things is completely different. But having that confidence from the fire brigade and taking it into the medical side of things, it helped me a lot. It helped me to think before I acted. So if you just take 2 seconds to think before you act, it can save a lot of time. And just little things like that, just being prepared. I always had gloves in my pocket. You know, I always made sure that the kits were ready to go in the ambulance, one placement. So it's just little things like that, and knowing where your equipment was. Because the equipment we used on workshop is completely different to the equipment that we used on placement. So getting to know that equipment on placement was vital in knowing where everything was when you needed it.
So what advice would you give to other students to get the most out of their placement experience?
Always work within your scope of practice, but don't be afraid to get in and take control, because you've always got somebody there that's more qualified than you while you're doing your placement. And that's why I had the confidence to go forward and do what I did in the mines, but I also had the knowledge, knowing that somebody was behind me just in case something did happen that was outside of my scope of practice, where he could step in and take over. So get involved, don't be afraid, and trust in your own ability, because once you're doing placement, you've already done your workshop, so it just gives you that extra edge, and it gives you the confidence to just go to the next level.
Has it confirmed to you that you're on the right path and this is something that you're going to really enjoy?
Absolutely, yeah. I'm going to start my mines rescue course in the next couple of months, which I'll just do that little bit by little bit. I've done most of it before. I've done breathing apparatus, fire rescue, vertical rescue. So yeah, I am, and if I can combine the two, I just think it's something that I really want to do and go forward, going into the mining boom.
So just going back to some of the advice that you gave students, you really stepped out. You, as you said, paid a bit of extra money to follow an opportunity outside your region, instead of, I guess, showing a bit more initiative than going down to your local place and asking whether they have any hours. Do you think that was particularly beneficial, to step outside of your region and step outside of your comfort zone?
Yeah, absolutely. Look, it cost me $700-800, but it was the best money I've spent in a long time. And you've got you just think outside the box, and just it's something a little bit different that you're doing. You know, you can go to the local medical surgery and, you know, do everyday stuff, but think outside the box and think, where do I want to go? What do I want to do with this? And I think we had an old saying in the fire brigade, and it was, what was it? Train hard and fight easy. So you were fighting fires easy because you were training hard. And I think that's something that you should look at while you're learning. And I see so much of, and I get like it at times, people going, oh, I've lost my mojo and I've lost the motivation. Well, think about the end result. Just keep going, take small steps. And that's what I did. But once this mine placement came up, I thought, yeah, that's what I want to do. And you've just got to just think outside the box and keep focused on the end result. Because we pay a lot of money to do this course, and a lot of people are saying, oh, I've just lost the motivation. Well, think about the money you've spent and think about the end result, that you're going to be qualified to save lives. That's what we all want. And you get a lot of enjoyment from it, because I saved countless lives in the fire brigade. We lost a few, but we saved more than we lost. So just think of the end result.
Fantastic. Ian, thanks so much for your time today.
No problem. Thank you.
Thank you.